And just checking, we have time for one question. I do have questions prepared, but I wanted to put it out first to the audience to see if there's anyone that has a burning question they wanted to make sure to get the opportunity to ask. So I will, just to address the group, I think one of the things that really was a poignant point that each of you made was the need for these policy interventions at the federal, state, and local levels. But Anna, you made a really significant point of sometimes there's this gap in time where policies are being enacted, and then what do you do in the interim? Whether at the local level, at the state level, or at the federal level. So I'm interested in getting an understanding of, one, if you had some policy recommendations that if it was your world to make that change, if there was a change you would make, and what kind of fillers you would like to see in the interim, and to all groups.
I guess there's always things you can do in the interim. Again, it depends on the individual level and thinking of each program. But, you know, first of all, every child care program, home, needs to have a voice in that process and thinking. And sometimes that doesn't always happen, or the ability just to even coming here to make sure I was on a phone call to get all the information. Some child care program directors are still at home, still at their centers, can't get out. So how do we give voice to everybody in that process? So I think that is one of the ways, whether you're doing some focus groups or interviews or something that occurs for them that they can be a part of to start that conversation, because first it has to start a conversation. And once you put that into someone's mindset, then they of course, can do some things on their own. But if they don't have that opportunity, they can't. So and just making sure that as for the people who make the decisions, just to really think about that process and how it affects everybody, not just a few, because sometimes in the state of North Carolina, it is focused on people, or a set number of folks, and not on all. So I want to make sure that's focused on everybody.
Great, thank you so much. And Daithi, from the state perspective then, kind of to Anna's point about how to make that affect all.
Well, I would say local partners and peer-to-peer learning, and you know, spreading the word about the things we're doing. I think that, you know, what I tried to say is that policy and state government and et cetera can only reach a certain audience and only go so far. And I think even more powerful is connecting to our communities and to the good work that's going on, and especially in the area of equity and targeting underserved populations, which, you know, they're not in a 5-star program, so whatever we do at policy is not going to make a difference for them. So we have some great community partners that we're working with and helping to connect us to those programs and those providers, because like I said, all of them that I've met want to serve good food, want their kids to be physically active, want to be breastfeeding friendly, want to have less screen time. I mean, they know all the things, but it's a capacity thing, and it's having peers and having support, and of course funding. So.
And then Debbie, from your from the federal perspective, that question of voice and equity.
So I think a couple of things. We need to make sure that whenever we're developing federal policy, that it's informed by what's happening on the ground, and informed both local and state. And as your point earlier, Ann, the provider, you know, what's happening on the ground is really informing the policies we develop. So I think that's really important. The second thing is, I think it needs to be said that we're going to have a new president next year, and so we need to make sure that all the things that we've accomplished are maintained. At a minimum, that those things are maintained, that there's no backtracking. So the wonderful things that have happened with the child care and adult food program, the changes that have been happening with licensing, those kinds of things, that we don't backtrack, and that so that's going to require us at a federal level, a national level, to really keep the awareness of what we've been doing and the successes, and do some real advocacy for what's been happening in terms of early care and education. And then I think there's more we can do. I think that there are additional policies that, and more opportunities for state flexibility to really embed healthy eating, physical activity into the daily routines of childcare, as long as there's input, of course, from both states and providers. And in terms of your other question about applying what works, we know a lot about what works, and we know also about the challenges. And I mentioned earlier that, we had this conference in 2016 earlier today. We have a set of recommendations, and they're located on healthykidshealthyfuture.org. Those are things that we can use at a practical level to apply in the interim. So both in the interim and also policy changes that we need to kind of protect.
Great, thank you so much, and thank you everyone for the great conversation and great information that you shared on the panel today. We're going to now turn it over to, I'm going to invite up Becky Johnson, who's going to moderate our next panel from the Healthy Weight Commitment Foundation, focusing on what business can do in the role of obesity prevention. Thank you, guys.